So next up, outpatient heart failure management. So you have patients that come in and see you in the clinic after discharging from the hospital in acute decompensated heart failure. Important to assess at every visit medication and dietary and lifestyle compliance. Important to document their dry weight and of course a detailed volume exam assessing for JVD, lower extremity edema. And assess symptoms, and important to classify ACC, a stage, and NYHA class as well. So patients can be seen on a timeline and essentially how their symptoms progress, improve or regress as well. So always important, of course, to review current GDMT and optimize as appropriate and as patient can tolerate. Review ambulatory and home blood pressure monitoring for GDMT titration targets, and of course taking into account the goal dosages as we discussed in a previous podcast. So lab monitoring, BMP magnesium level 1 to 2 weeks following up titration of ARNI or ACE inhibitor. Spironolactone, of course, requires close monitoring of potassium and creatinine level. So any of these medications is important to check BMP and magnesium level 1 to 2 weeks after dose titration. So essentially the goal dosage, as we discussed previously, without symptomatic hypotension. So patients can have a lower blood pressure, and a lot of these patients do. However, it's important to assess further symptoms or of course metabolic disarray like increased creatinine or electrolyte derangements. Principles essentially to start GDMT immediately on diagnosis. It can be quadruple therapy at lower than target dosing is preferred over maxing out a single agent. So starting all of these medications at once at the starting dose is preferred over, for example, maxing out a beta blocker or an ARNI. Of course, as discussed previously, it's important to avoid NSAIDs, calcium channel blockers, flecainide, especially patients with structural changes on echo or reduced EF. It's a class 3 indication, steroids, over-the-counter decongestants in these patients. So when looking at their medications in the outpatient setting, not only looking at GDMT but other medications as well that can interfere with their management.